G'day guys, Dr. Josh Jones from Albert Road General Practice in South Melbourne. Today I want to talk to you about screening tests. A screening test is something we do in a person who generally has no signs or symptoms of a disease, but may be in a risk demographic or age group. So some examples you might already know about would be the bowel cancer screening test. That's done in men and women over the age of 50 every 2 years. Mammograms, which is looking for breast cancer, that's done in women over the age of 50 every 2 years. And the cervical screening test, which used to be known as the pap smear test, that's done in women over the age of 25 who are sexually active. Sexually transmitted infection checks, STI checks, are generally recommended every 12 months in people who are sexually active and under the age of 30. Also, if you have a new sexual partner or an unprotected sexual encounter with a new partner, we would recommend an STI check around that time. Some other examples of preventive health checks and screens would be cholesterol checks and diabetes checks. We can combine the results of these tests to calculate your risk of diabetes and heart disease in the near future. When you actually start these tests is determined by your individual risk factors such as family history, lifestyle, exercise habits, blood pressure and things like that. A consultation with your GP is really important to determine if you're up to date with your screening tests or not and what screening tests might be on the radar for the near future. So prevention is so much more effective than treating diseases. When you have developed disease such as diabetes or heart disease, for example, we're just really doing damage control with medication and hopefully lifestyle as well. When you get in early and actually detect early changes which indicate a risk for developing a disease, you can avert the course sometimes and prevent the disease from coming on at all, or at the very least you can delay the onset of that disease, which means that the damage to your body is heavily reduced compared to if you present at the time you already have symptoms of disease. So, in summation, think about screening checks and think about preventive health. Have a consultation with your GP to determine whether you're up to date or not. This can be done via telehealth for sure. In certain circumstances where safe to do so, it might also be appropriate to do this face-to-face. So don't delay, get on top of your screening and live a longer, healthier, happier life as a result. Thanks guys.